I call the Honourable Lua Manavao Winnie Laban.
Mr Speaker, kia ora, Mr Speaker, kia ora mai anō tātou katoa ki taku whānau. E ngā iwi, e ngā rangatira, tēnā koutou katoa, kia ora te rupu reipa, aroha, te rupu reipa toa. He tangata, he tangata, he tangata. Talofa lava and warm Pacific greetings, and I want to put substance to accountability, transparency, value for money and value for people. Due to the 2010 budget, district health boards will now no longer have enough to continue services at their current level. Even the frontline services, supposedly given a 3.5% increase, will be cut after inflation and wage increases are taken into account. The evidence is clear right around the country. Morale is low in the health centre and they are expected to put a positive spin on what's happening. As we have seen in the budget, $186 million over 4 years has been cut from what the government calls lower priority spending. This includes public health, mental health and the primary health care strategy. The elderly are going without home support because the government regards them as a lower priority spend. These figures represent real people who are missing out on services. More than 80 frontline services have been cut in the last 18 months in nearly every region in New Zealand. Those services range from massive reductions in home-based support for the elderly, plans to cut beds in community hospitals, which have just been opened, through to a decision to turn people away at emergency departments. Sadly, these cuts are already being felt very strongly, and particularly in the area of aged care. I am hearing time and time again the problems relating to care of the elderly, aged care in New Zealand, right round the coast of the country. Most of the comments, Minister, I hear are related to certain main themes: a lack of qualified staff, especially registered nurses, and a shortage of overall staff. What staff there are underpaid, undertrained, especially healthcare assistants and other caregivers. This leads to inadequate care both in rest homes and within the home-based sector. Home help has been cut over the phone by these assessments. I've heard many stories of elderly people finding medical care to be very elusive, such as spending hours waiting for an appointment at accident and emergency centres, only to be sent back to GPs. Horror stories about the state of aged care in our country abound in the media. There is huge concern about the state of home care in particular, and we all hear hugely concerning stories about cuts in this area, and it means a lot of our elderly are anxious, they're worried, and they feel unwell. For instance, I heard the story of a lady who had only half an hour care support a week. The assessor declined her specific request to be assessed in person, and she was told by the caregiver that she will no longer come because of the distance to her house. Another elderly woman who suffers from a spinal injury had 1 hour home help per week. After assessment, she negotiated a drop to just 1 hour per fortnight. Since then, it has been cut entirely. She cannot manage her own cleaning and day-to-day tasks. It is stories like these that have led Grey Power in Southland to lodge a case with the Human Rights Commission about cuts to home help in Southland, as reported by the Southland Times today. It comes after a huge number of stories of how cuts are impacting on our elderly right round our country. It is hugely unfair to deprive the elderly of such basic care, but how is it even cost effective? Without access to home support, many elderly will have to seek out residential care, which costs far more and takes them out of their own homes, often forcing them to move many miles away. How much more frontline can you get than home help for our elderly? This government talks a lot about shifting resources to frontline staff, yet a service that provides them home help for our most vulnerable people, our elders, is the first to be gutted. How can the Health Minister be comfortable when the results of the cuts he is imposing are so obviously having such damaging effects on our elderly. In human terms, they're a generation who have worked very hard
Order.
and contributed enormously.